Dr. Ruth Gautier, the Administrative Director of the Tri-Institutional MD-PhD program, and we're starting a new series where we're going to meet several of our MD-PhD students so you can see what it's like as an MD-PhD student in the Weill Cornell, Rockefeller, Sloan Kettering Tri-Institutional MD-PhD program. So here we have Andrew. And what year are you in?
I just have began the 6th year of the program.
Really? 6th year already. Okay. And why don't you tell us why you decided to do MD-PhD?
So for me, I'm interested in both science, but also in applying science in ways that can help people. So medicine seemed like an obvious choice, and then having the opportunity to think through these kinds of problems, I just could think of nothing better to do with my life. What really drew me to this sort of work in the first place was my experience with my brother. So growing up, he had Crohn's disease, and wasn't diagnosed until he was around 10 or so. So I remember him being in and out of hospitals, losing weight, looking very ill, and for a while we didn't really know what was the problem. Unfortunately, Crohn's disease is a diagnosis by exclusion, but they did figure it out. And then, fortunately, when he was still fairly young, they came out with this new treatment, Humira, and it was like switching a light. As soon as he went on that, it was amazing. He gained, he was back to his healthy weight, and he was able to enjoy the things that he had previously, and it was just really fascinating. And amazing. It was literally life-changing.
Wow. So how did that impact you?
Seeing how, from experiencing it myself, people can be very frightened in these situations, and knowing that physicians can be there to comfort when there's these times of uncertainty, and then the hope that there is an answer out there and an eventual treatment. This really was a major impact for me and for the decisions I made, and I just thought I wanted to be a part of that.
Wow. Now you come from a very quantitative background.
I do, yes.
So tell us a little bit about that and how you made that transition to decide to become a MD-PhD, because there are not all that many with such a heavy quantitative background.
Something that I hope will change. So I studied physics in undergrad, and I really enjoyed the coursework that I did in physics and also in biology, and became really fascinated with how the quantitative tools could be applied to sciences outside of the usual physical realm. For instance, I think the physics behind MRI is just beautiful and fascinating, and that's actually the first rotation I did here in the program was in an MRI lab. But my view is as we continue to improve our technology, we're gathering more and more information, and we're getting to the point where the problems that we can now answer require a very deep understanding of mathematics. For instance, if you want to figure out how to address an arrhythmia in a heart, heart you can model with a dynamical system comprising, just a huge number of equations. So how do we deal with that? Well, we need a firm understanding of mathematics. Other things like the field seems to be going towards personalized medicine. Right. So looking at what our genomes tell us about what sorts of treatments would be useful. So dealing with just huge amounts of information, we need to understand how we can represent that information, how we can express it in an understandable way, and then act on the useful information that may be buried in tons of data.
Right. And how is that all related to your research that you're doing now?
So what I'm doing now, so I'm in Jim Hudspeth's lab, the lab studies hearing, and my project so far has been working on a mathematical model that can help us to understand how our sense of hearing can be robust despite developmental variation. So your ears are probably a bit different from my ears, but somehow biology has figured out how to handle those differences, and still we hear equally well. So my goal in joining this lab was to better understand quantitative tools, sort of develop these skills so that I can apply it to other problems in medicine. So this is a great way to approach biology, having this arsenal of strategies. If you really want to understand a system, if you can describe it with an equation, then that's a simple way of understanding and then communicating your ideas. So that's interesting in and of itself for me, and I'd also like to take the tools that I've learned and apply them to more clinical problems. So I'm also engaged in some research with a few radiation oncologists and medical physicists, trying to develop a better way to handle respiratory motion. So they use radiation to treat lung tumors, but lung tumors present a moving target. They continually move as you breathe, and this means that we have to irradiate large areas of healthy tissue to ensure that we are getting the entire tumor. So if we can avoid that, that would be great, and we would certainly have better outcomes for our patients.
Nice. And tell us, you recently had a publication.
I did.
Congratulations.
Thank you. So the work I described to you earlier that I've been doing in the Hesworth Lab was recently published, which feels great. It's my first author publication.
Congratulations. First of many.
Hopefully.
Great. So let's change gears for a minute. So you've been a Big Sib, a peer mentor in the Gateways to Laboratory program for how many years now?
This is the third year that I've been a Big Sib, and the fourth year that I think I've been involved in some way with the program, and it's just been phenomenal. The program is amazing.
I'm so glad you like it. So you go through a mentor training, and one of the things that stuck out to me that you said probably a year or two ago, you were very passionate about it when we were discussing how to teach things to the next generation of physician scientists. And one of the most remarkable things I think you've ever said is nobody is unteachable. Where did that come from?
So, it's a firm belief that I have, and I think this stems in part from a lot of the discouragement I see people feeling, often unfortunately in physical sciences, in the mathematics. Like many other things, being successful in those fields really does depend a lot on how much preparation you've had and how much time and practice you've gotten. So I'm convinced that given enough time, these seemingly complicated ideas can absolutely be taught to anybody who is interested. I think the Gateways program also ties in with this belief. Unfortunately, some people don't have the access to a lot of let's say educational opportunities when they were growing up, and maybe that sort of puts them back a little bit compared to some of their peers. But this doesn't mean that they don't have the ability.
Right.
It just means that they need some more practice and some more time. They'll absolutely get there.
And I've seen you practice what you preach. So I've seen you really work at teaching people till they really get it. And your students always have the best presentations. So
thank you.
I'm really excited. So you also do quite a bit of community service work. So what is some of your favorite things that you participate in?
Well, aside from the Gateways program, which is, I absolutely love working as a mentor and as a Big Sib, my other primary extracurricular is working with the Weill Cornell Center for Human Rights. So this is the first medical student-run asylum clinic at a medical school in the nation. And what we do is provide pro bono forensic medical evaluations for individuals seeking asylum in the United States. So these are people who have fled their country to escape torture, abuse, persecution. And as you can imagine, often the only evidence that they carry with them are literally the physical and psychological scars. So we perform a medical interview and exam to document those scars that they may have, and then put this in a medical legal affidavit that serves as evidence in immigration court. And I think this organization is really a unique and fantastic opportunity for medical students. We are all interested in helping, but most of the things that we hope to help with eventually takes a bit of time to get there. You're not going to help out with open heart surgery on day one.
Correct.
This is an activity you can help out on day one, as a first-year medical student, you can attend the training and then immediately begin participating in evaluations.
Wow.
And the medical students draft the affidavit, so their words literally are contributing to the client's case.
I got chills. I got chills from that. Wow, that's incredible. So you're almost done with your PhD.
I'm planning to defend in a year, yes.
Wow, wow. So what's next?
Well, next I'll finish medical school.
Correct.
And so I have a couple ideas for what I'd like to do. I would love to practice medicine and do research. The 80-20 model
Right.
sounds like a wonderful way to do things. So I haven't done any clerkships yet, so I only have vague ideas of
Right.
which medical specialty. Radiation oncology seems like a nice fit because I could very easily continue applying quantitative tools to medically relevant problems. So we'll see how that plays out, see what I like when I get back to medical school.
All right, time will tell.
Yes.
And now you're towards the end of the your transitional MD-PhD program experience.
It's gone by
going
too
by
quickly.
fast. I remember you as an applicant. What's been your favorite part?
Oh, that's a very difficult question because so many facets of the experience have been great. So medical school was a lot of fun, getting to know my peers. I should even back up before that. The first summer that we were here was so much fun, just us MD-PhD students bonding,
Yes.
getting to know each other, going on the first cruise that I participated in.
The cruise retreat.
The cruise retreat, exactly. Which, by the way, I think is, I mean, this is a fantastic idea that you've come up with. I love getting to know the other years in the program, and putting us on a boat where we can't escape for a few days is a great way to get us to interact.
That's great vertical mentoring.
Exactly. So getting to know my peers, learning about, both normal and abnormal physiology. Some of the most exciting information that I have learned I got in my first year as medical school. I have had the good fortune of having a really fantastic mentor, Jim Hudspeth, as my PI. So what attracted me to his lab, in addition to the fantastic science that he's doing, is the way that he communicates his work. So he gave a lecture to our medical school class, and I just thought, I want to be able to communicate science as clearly and effectively as he does.
Nice.
So hopefully I've picked up some
Nice.
skills from him. So the experience itself has been great, and I think this is due in large part to the people here, my classmates, both in my year and other years, and also the administration. You, Dr. Anderson, Dr. Buck, and Dr. Pecker. I have always felt very supported, and anytime I go to Dr. Anderson or come to you with an idea, the response is, how can we do this, rather than it's too challenging or not possible.
That means a lot that you said that, because we didn't even pay you to say that. So one final question I had. So you've obviously been very accomplished and you're succeeding exceedingly well.
You're too kind.
Has anyone, when you were thinking of applying to MD-PhD programs, has anyone ever told you not to do it?
Yes, and I hope that this experience is becoming rarer. So I spoke with some advisors in the, I can't even remember the name of the department, but the
probably better you don't say.
And they said that they didn't think that I would be well suited to this sort of program, or that I would be a strong applicant. So in my undergrad days, I did a lot of teaching, and as we've already discussed, maybe I'm a little bit non-traditional because I'm coming from physics. And again, I hope this is something that's going to change. I think the more people who have access and facility with quantitative tools, the better. You don't have to be a physicist, but a biologist who understands how to do principal component analysis, great. But anyways, they thought that MD-PhD programs wouldn't be appreciative of the teaching and background that I had, and thought that I wouldn't be a strong applicant. And that was, tough to hear. These are individuals who are supposedly trained to give advice on these topics, and they were dead wrong.
And you proved them wrong.
I proved them wrong, and if anybody is in a similar situation, I encourage them to reach out to this program. I'd be happy to speak with them personally and let them know that their skills are absolutely valued.
Great. Thank you. So maybe you turned one person who is doubting if it's possible. Maybe you turn them around.
I really hope so.
Let's go. Thank you. I appreciate it.